Hello, everyone. Welcome to Fall 25 Health Insurance Webinar. Thank you for joining us today. I want to give a couple of more minutes for everybody to come in and so we can start this webinar. While we're waiting for that, I just want to quickly remind everyone that if you have any questions during or after the seminar, please put them in with the Q&A. There's a Q&A tab right here at the bottom, and you can put in your questions there. We will either answer those questions live or so one of the team members will put in the answers for you there. Looks like people are adding up, so I'm going to wait a few more seconds here.
Hey, good afternoon, everybody.
Hi, Luis. How are you today?
Good. Thank you for having us. Just checking the mic and video.
All right, looks good. Looks like we have enough people here, so we're going to start the webinar. Once again, welcome to Fall 2025 Health Insurance Webinar. My name is KJ Faruqi. I will be starting this webinar, and then we're going to move it over to the health team to talk about the stuff that they need to talk to you about regarding health insurance here at ASU. So today's agenda is that we're going to talk about, I'm going to give you a quick ISSC introduction, then we're going to talk about a little about the pre-arrival session here, and then the health insurance team is going to take over from there. This is what our ISSC team looks like. We have faces adding and all the time. As you can see, we're a pretty big team. We are here to help you and support you. So feel free to reach out to us anytime you need any help before or after you get here. Our office in Tempe here is located in Student Services building. And this is what the front of our office looks like. We welcome students from more than 158 countries from the world. So please feel free to be at home when you get here. Thank you. Okay, I'm going to give it to Joelle. She's going to talk about the rest of the slides.
Hello, everyone. My name is Joelle. I work in ISSC. The best way to contact us is through the different things that you see here. So we are always reachable by email, issc@asu.edu. You can also use our phone number, 480-727-4776. We are available Monday through Friday at this number from 8 a.m. to 5 p.m. in Arizona time. Okay. We also offer virtual drop-in and in-person advising hours. You can also look at those at the link. So when we share this presentation out, you can get access to that. Any students that need really support with any F1 immigration issues are highly encouraged to come to these meetings because our advisors are immigration advisors. They support with all of your F1 visa needs. Okay. We also have a section for J1 as well. The advising sessions are indicated on this slide, and each appointment is limited to about 20 minutes. So please keep that in mind. We have our main office is in Tempe campus for F1 students. We also have offices in downtown Phoenix campus, where we have an advisor that visits on specific drop-on days every Monday, and the hours are from 9 to 11 a.m. and 1 to 3 p.m. At Polytechnic, we also have an advisor that's present from Monday through Thursday every week. So please make sure that you take this information down. And on West Valley campus, we have an advisor on Tuesdays, every Tuesday, available to support you at the hours that are written below. Some important reminders that you have is that the last day I-20s can be issued outside of the US are July 22nd, which is today. So if you have not received your initial I-20 yet, please contact the admissions office. The mandatory CVIS check-in with ISSC, so that's after you get your I-20, you get your F1 visa, and you've arrived to the US, you are required to do this between July 22nd and August 21st. You're also required to submit your measles, mumps, and rubella immunization record through your My ASU Health portal before the start of classes. Failure to do this will result in an enrollment hold. Please also, so you can register for classes and participate in the orientations, you will be required to pay the enrollment deposit. This was due on May 1st. You can still pay it. It's not too late. And you should register for classes before August 21st. Ideally, you need to do this before you depart and arrive in the US. Okay, so please check with your college, check your My ASU page, and make sure that you are up to date with all of your priority tasks.
Hello everyone, I'm Yaya. I'm the Senior Coordinator here at the ISSC. I'd like for you to check out our website, issc.asu.edu. It will be the best resource out there for you because this is where you can set your appointments with us. You can get up-to-date info. You can check the calendar where we put all our events. And it is where you will also access your e-forms for anything that you may need and much more. And then these are all our social medias. We have Facebook, LinkedIn, YouTube, Instagram, and WeChat. This webinar will be recorded and uploaded on our YouTube sometime next week or in 2 weeks. Now I'll be handing it over to our health insurance team, where they will be talking about the student health insurance plan and access to medical care. Handing it over to you, Louis.
Okay, good afternoon, everyone, and I want to thank the ISSC team for having us here this afternoon. We're going to be sharing some very, very important information regarding your student health insurance plan and also access to medical care here on campus and off campus as well. Now, this is a resource that perhaps is not on the top of everyone's list, but I can assure you it's very critical to know this basic information because it's going to be a little bit different, or should I say a lot different than your home country. And it is going to take some time, some effort, some participation in learning how to navigate through the healthcare system here in the United States. So if we can go on to the next slide. I do want to introduce our staff. We have an entire team here to assist you throughout your time here at ASU. Again, we're the Student Health Insurance Plan team, the department here on campus. We like to refer the Student Health Insurance Plan as the SHIP plan. Okay, we can always, to make it simplify and kind of across the board, we can call it SHIP. My name is Luis Galaz. Again, I'm the patient advocate. I'm also the manager, and I have a couple of roles here at the health center. We also have our student health insurance office specialist, who's a referral supervisor who works very closely with us as well. Her name is Jessica Crede. We also have our coworker who works in referrals and in student and education, Kristen Hansen. Our contact information is on the board. We have our email information and also our phone number. But in a little bit, we're going to give you the main channel on how you'll get a hold of us throughout the semester once you arrive. So now, the U.S. healthcare system, as some of you might have heard already, and if not, we're here to kind of give you a really quick introduction. The U.S. healthcare system is very different than most places around the world. It is important to know that if you do not have health insurance or the proper insurance, coverage and billing is very, very expensive here in the United States. And it's something that can be shocking for first-timers here in the US. Now, health insurance does require individuals to pay some things out of pocket, even though the insurance is already going to be billed to your student account. So one of the requirements as an international student who's on an F1 or J1 visa, it is mandatory and it will be billed to your student account each semester. So please, when you're going through your account, it's something to get good practice of. you see itemized list of different fees and tuition charges, you'll see one that says student health insurance, and that will be posted every semester. And it's going to be very important for you to know and understand some basic policy guidelines and information. And again, this is just going to be an introduction today. A little bit later, we will have the opportunity to ask questions and elaborate on anything that you would like to talk about, just as long as it does not get personal and it doesn't go into too much detail. Now, the SHIP plan, or the Student Health Insurance Plan, the company that is going to be the contracting company for this plan is United Healthcare Student Resources. This is one of the largest, if not the largest, health insurance company in the United States. Yours, for the purposes of your policy through the university, is called United Healthcare Student Resources, and it's on the screen there. There's two major reasons that someone does have health insurance here in the US. One is going to be to provide coverage for when you're sick. It's also going to provide coverage when you get an injury or you have an injury. And also, the third one is for preventive care. It will cover routine exams and immunizations as needed. So it covers pretty much all your healthcare needs under this policy. The second reason that you have insurance and the appropriate insurance is to keep you from having very, very expensive or high medical bills. Again, as we mentioned a few minutes ago, healthcare and health insurance and these types of services in the United States are very, very expensive. And again, if you're not aware, they can be very shocking. And to give you just a quick example, just going to a specialist here without insurance can cost $300 or $400 easily. Okay, if you go to an emergency room, a bill can be from $3,000 to $10,000 very easily. If you end up in the hospital for 2 or 3 days, a bill can be $50,000 very easily. So this is the reason why the university has required that you have this insurance. And again, we're going to go over some of the basics throughout the next hour and answer questions regarding it. Now, this is a top-tiered insurance policy. Okay, it's one of the best that I have found here in the US. I speak to hundreds, if not thousands, of students throughout the country. And we always get feedback from parents, from students, saying that they're very impressed with this insurance policy coverage. And there is value in what you're paying for and what you're receiving in coverage. So again, it's a top-tiered insurance policy. For fall 25 coverage period began on July 19th. If you're a new international student coming in for the fall, it will go through December 31st. Your account should have been billed already, $1,258. And whether the bill is paid or not, and it's on your account, you are covered already, okay? Now, it's important to note that coverage cannot be changed or modified. I can't stress it again that international students are required to be enrolled and are automatically put into the plan each semester. There is some information that we can provide regarding dental and vision, okay? And we have a link that you can visit. But just to give you a bigger picture, in the United States, dental and vision are usually separate than medical insurance. Now, with that being said, if you are under the age of 19, you do have dental and vision coverage. It is required by the state of Arizona, if you're under the age of 19, that your medical plan include dental and vision. Unfortunately, if you're 19 and over, those services or benefits are not covered. But again, we have details and information on a discount plan you can purchase for those separate coverages. Now, this is one of the most important slides, and it's a lot, again, different from feedback we get from students. We talk to students from all over the country, all over the world, and a lot of students in other countries are telling us that they usually go to one health center, or it's common to go to one health center for all your care. It's kind of a building or a facility or a location that kind of encompasses all your care. Things might be a little bit different here in the United States, but again, this is going to be one of the slides that's really, really important that you really want to pay attention to, maybe make some notes. But the first and foremost, your first stop will always be the health center on campus, okay? And the counseling center on campus. The good news is that there is a comprehensive health center here on the Tempe campus, on the Phoenix campus, on the West campus, or the Poly campus. So whatever campus you're having classes or visiting, you have access to any of the health centers. They're located usually in the center of campus, easy to find, easy to locate. It's convenient, and this is going to be your first stop. And this is a requirement of your insurance company. So please make note that your primary care, your first stop is on campus. We also want to point out that the health center does have an after hours line, our general line. After we close, we're open from Monday through Friday from 8 to 4:30 or 5. But after we close, you can still call the health center and you'll be connected to a provider. And that provider will be able to talk to you and give you medical advice and guide you if and when needed. Now, if you need an off-campus provider, okay, maybe you need something off-campus that we can't provide here at the health center, that's okay, because you're still going to come to the health center first. And when you come to the health center, you're going to need to get a referral. And then we're going to assist you with connecting providers with off-campus providers that work with your insurance company. Now, again, this is very important because the insurance company requires, before you go off campus, that you get a referral for specialist visits and for things that we can't provide or are better provided off campus. And with that being said, there's two exceptions. There's some places off campus that you can go to. We call them urgent care is one of them, and the other one's an emergency room. Now, urgent care is usually a place off campus. This is somewhere you would usually go if the health center is closed, or maybe you can't get an appointment with the health center. Then the next place you would go in the next step would be urgent care. This is not for life-threatening emergencies, but it's for things that can't wait 2 or 3 days, or that you want to try to talk to somebody today, and you don't need a referral to go to an urgent care, but you do need to confirm that they work with your insurance company. And we'll kind of go through how to find these providers that work with your insurance company in a few minutes. Now, emergency care, emergency rooms. If you have a life-threatening emergency, this is serious. This is a situation where if you don't get to the hospital or to a doctor, it could possibly be fatal. So whether you're on campus or off campus, you're going to always dial 911 in an emergency, or just get straight to the nearest hospital emergency room. I want to be clear, the health center on campus is a health center. It's a medical clinic. It's not an emergency room. So please, always in an emergency, get to the nearest emergency room or dial 911 on or off campus. And again, referrals are not required for urgent care visits and emergency room visits. Now, if you happen to go to an urgent care off campus in the evening or on a weekend, same thing with emergency care, and they want to write you referrals to other providers from that point, you do have to come back to the health center the following day or as soon as possible so we can issue the referrals from the health center. That is a requirement of the insurance company. Referrals from the emergency room or urgent care center are not valid in the eyes of the insurance company. And another reason why we want you to check in is so we can help you and assist you with what other things you may need throughout the semester regarding this emergency room visit or urgent care visit. So always make a note when you're off campus to use providers and places that work with your insurance company. And again, we'll let you know how to find who's in network and who's not. We can go on to the next slide. Yeah, this is a quick reference. It's a visual. We're always working to improve kind of how this looks, but for now, it again paints the picture that if you have a life-threatening emergency, dial 911 or go to the nearest emergency room. There's nothing to think about. If it's Monday through Friday, 8 to 5, you're going to want to come to the health center. Okay, first and foremost, that's what the insurance requires. If you need referrals, we'll write you referrals from the health center. If you can't get an appointment at the health center during the Monday through Friday, 8 to 5, or after our hours, you can go straight to urgent care as well. So again, this is just a visual, and it's something that we hope is helpful. This previous slide has it in writing, but we just wanted to kind of paint a picture on what that would look like. If we could go on to the next slide, KJ. Now, we did talk about that although you're being billed for the insurance and you will be billed to your account, there's still some costs that you're responsible for. And again, this is nothing different. This is not unusual. As a matter of fact, this is the norm. Okay, this is the norm here in the US. We pay for our insurance monthly, but when we use it, we still have to pay a portion of some of the visits and some of the services. To kind of simplify this with your insurance policy, on campus, you will only have two fees that go to your student account. One is going to be for office visits to the health center, and it doesn't matter what type of office visit it is, you will have a $15 fee, and that will be billed to your student account, usually probably about within a week of your visit here. Now, on the Tempe campus, we do labs and x-rays. There is a $10 fee for those services. And again, that will be billed to your student account within about a week of you getting that service here at the health center. Now, again, we don't charge or bill you when you come into the health center, so we don't want you worrying about that. It's an automatic process, and it gets posted again to your ASU account. So don't forget to check your account throughout the semester. And it's a good practice, not only for the health center, but a lot of things on campus may be billed to your student account just so you can stay on top of that. Now, if you need services off campus, okay, whether you go to an urgent care, whether you go to a specialist, you will need that referral for specialist visits, of course, and you will need to stay in the network. If you go to off-campus places, you have different fees, and you will pay those providers off campus the fees. They do not get billed to your ASU account. Please make a note of that. So specialist visits with your referral are $25. Urgent care visits are $25. If you go to the emergency room, it will be $200. So you can see the insurance company is kind of leading you and guiding you and helping you think through the process on where you really got to go. And the fee kind of helps determine where you need to go and what you're looking for. Now, if you need to be hospitalized, you need surgeries, you need special procedures, there's some additional fees. This is a really simplified way to look at it. There are some nuances and some other details depending on the situation. But just to give you a kind of a generic overview, if you were to be hospitalized or need a surgery, you pay the first $250, okay, of that bill, and then an additional 20% of the rest of the bill. The insurance company will pay the 80%, which is left over, and which is the total is probably about 80% of the entire bill. Prescriptions, to make things a little bit more complicated, okay? Prescriptions, you end up paying the first $125 of the cost of any prescription at full price. Prescriptions here vary. Some prescriptions may cost $20, some may cost hundreds of dollars, some may cost thousands of dollars. But the insurance company puts your prescriptions into tier levels or categories. You have a $15 category, a $40 category, and $80 category. Once you pay the first $125, then your prescription will fall into one of the categories, and you would be able to look up the categories online once we give you more information on how to access this information through your health plan. Now, this is a lot of information, a lot of details. In some cases, just to oversimplify, the great news about this is that you have a maximum out of pocket. This maximum out of pocket is really a protection for you, the student, the policy holder. In one particular school year, which includes the fall, the spring, and the summer, you are protected under this insurance policy at not paying more than $1,500 US. Yes, that is a lot of money. But for the purposes of being in the US and receiving healthcare, I can assure you it is not. But if you follow the plan's rules, if you follow their guidelines, you get referrals, you stay in the network, okay, and you use the insurance properly the way they require you to, you will be protected at $1,500. And again, I mentioned earlier that going to the hospital for a day or two or even 3 days can be $50,000. We've seen it regularly. Okay, going to the emergency room could be $10,000. Going to specialists can be hundreds of dollars. But whatever you're responsible for paying under this policy, it will not exceed $1,500 in one policy year. So you are protected, and I can assure you, again, this is one of the best policies out there. And don't forget, when you use the health center or services on campus, it's built to your student account. When you go off campus, you pay those providers you're visiting. Now, one of the first things that you're going to need to do, and I want to be clear, United Healthcare Student Resources is your insurance plan. They are not ASU. And even though we have a student health insurance department, which I manage, and we have a team here to assist you, we are not the insurance company. So you do have to visit the website on your screen, United Healthcare Student Resources. It's UHCSR.com. And you must register your account. Okay, that's going to be the first step. Once you register your account, you're going to be able to access your insurance plan ID card. The ID card will not be mailed to you. Okay, it will not be sent to you in the mail. You're not going to expect it to show up. Okay, you have to create an account with the insurance company to access your ID card. Once you create that account, you'll also be able to review your plan information in more detail. They have tools in there that are going to assist you, and they have a tool to find in-network providers. Again, with this insurance plan, and really with any insurance plan that you may be on in the United States, it goes the same for my insurance plan through ASU. I have to use only providers that work with my particular plan. And you'll be able to have access to this through your account. And there's going to be all kinds of tools and additional resources there. Now, we do want to point out that you can download the UHCSR app, okay, on your phone. There's the ability to do it through the Apple Store and through the Play Store, okay? Once you download that app, you can open it up and register through the app as well. So you can have all this at your fingertips and on your phone. And we're going to encourage you to actually do that. We're also going to encourage you to print out a copy once you're in your account and carry one in your wallet and have one on your phone. Because that is something that we do here in the US, is carry our insurance ID card with us, with our ID and everything else we carry. Because you never know when you're going to need it. And, you know, it could be something that happens unexpectedly. It could be happening when you're traveling. And actually, when you go to any visit, the provider is going to ask you for your insurance information so they can know who to bill to get paid. Okay, and if you don't have that information at hand, it can complicate things. So please get in the habit of carrying your insurance card with you. Now, once you get to the website to register, this is what it'll look like. We highlighted the first button that says register now and sign in. The first thing you're going to do is register. Okay, you can't just sign in. It won't work. It won't let you in. You have not been preloaded. You have to register. And when you register, it's going to ask you for your first name, your last name, your date of birth, and your ASU ID number. Okay, once you do that, it will allow you to create your account. And then once you have that account created, the next time you come back in, you'll go ahead and press the blue sign in button. But initially, you have to register. There is some confusion with students regarding this matter, but again, you must register first. Now, as I mentioned, ASU Health Services, okay, is located on all the campuses here in the Phoenix area. Our main campus is in Tempe. We have our address. We're off of Palm Walk and the University Bridge. We also have our addresses to our other locations. The important thing to note here is that you have access to any of the health centers, regardless of where your program is listed, wherever your classes are. If you're going back and forth to different campuses or in a different area or visiting friends, please note that you have access to any of the health centers. And they're all open Monday through Friday from 8 to 4:30. And in a minute, we'll go ahead and show you how to make appointments as well. Now, ASU Health Services, or AKA, also the health center on campus, again, is easy access. Okay, we're here within the vicinity on campus. It's high quality healthcare. Our providers are specially trained to work with university students, and they do work with university students from all over the country and all over the world. We have primary care, we have preventive health care, we have women's health, especially designed for women. We have labs and x-rays. We do immunizations, vaccinations. There's the opportunity to see a provider in person, and in some cases through telehealth or telemedicine visits. And again, this is where you'll get your referrals to go off campus to specialists, to MRIs, or things that you need off campus that we can't provide or are better provided off campus. So again, most things that you will need will be done on campus. And I would go as far as to say probably 90 to 95% of what you may need will be done off campus. But if and when needed, our providers will provide you a referral, and we have a referral team to assist you to get connected to those resources. So you won't be alone. Now, I do want to point out, if you have not had the opportunity to go to your My ASU account, please do so. In your My ASU account, under the Campus Services tab, as highlighted on the screen, and under the Health and Wellness Resources, there's a link highlighted that says My Health Patient Portal. This is different and separate than your insurance company's registration account. This is your health portal to the health center on campus and to the counseling center on campus. This is your go-to for all your healthcare needs on campus. This is where you'll go and log into to make an appointment. This is where you can go to send messages to the student health insurance department, to the referrals department. You can send a message to your provider once you get a provider. This is where you can find your medical records once you start being seen here at the health center. This is where we're going to send you messages throughout the semester. As a matter of fact, I believe we sent you a message already in the last couple of days regarding your insurance, kind of describing all these details we're covering right now. So if you go to your portal now and you go into your messages, you should have at least one message from us covering all this information. So although I might miss something, and this is just a quick introduction, you have all of this in writing as well at your fingertips in your portal. So again, this is how you set up an appointment. This is how you communicate with the health center and the counseling center. And this is where we are directing all students to go to for assistance on campus. Now, these are some of the most frequently asked questions. I want to say that we've answered most of them in the previous slides. But if not, these might be some of the ones you have had, or if you have any additional ones, we're going to go over them and be able to kind of go through that in just a few minutes. But we already talked about receiving your insurance card. You actually won't receive it. You have to access it. You have to access your insurance card by creating and registering with your insurance company account. Where do I receive medical and counseling services? We already established that the health center and counseling center are your first stop and your primary care. Okay, unless obviously you have an emergency or you need urgent care. How do I schedule an appointment? We just went over your My Health Patient Portal that you have access to. Okay, that's how you would schedule an appointment and communicate with the health center and the counseling center on campus. Who can I contact if I need assistance? You'll be able to contact the insurance company directly if you have questions and need assistance and need to know about your coverage and your benefits regarding the insurance company. If you need assistance regarding healthcare or services, or just you need some support, you can contact the student health center or the counseling center on campus. How do I find in-network providers that work with my insurance company? Again, once you register your account with the insurance company, there's tools in there, and one of the tools will be finding in-network providers. They have that tool in there. And also on your insurance card, you're going to have a customer service number on the front of your insurance card where you can call the insurance company to get assistance with finding in-network providers. Can I get my MMR vaccinations on campus or any other immunizations or vaccinations that I may need? The answer is yes. That's one of the main benefits of having a health center on campus, is that preventive care is also done on campus. It's not just when you get sick or you get injured, but also for preventative care, such as immunizations and vaccinations. And again, we did highlight that if you're under the age of 19, dental and vision is covered under your medical plan. However, if you're 19 and over, dental and vision is not covered under your medical plan. But in a bit, we'll give you more detail and information on how you can purchase additional services for those things. Now, this is a very important resource. This last slide here, information and assistance. We are going to strongly encourage you to visit the ASU Health Services website, and the link is listed on the slide above. Also, the counseling website. It might take maybe 10 minutes, 5 to 10 minutes to go through it. Click around, go to the different tabs, check it out. If you have any questions, or you need clarification, you can then jump on your patient portal and send our department a question, and we would answer it that way. But for the most part, the information on our website is self-explanatory. It's pretty clear, it's concise. So again, it will be worth your 10 minutes to get on our websites and check that out. It'll answer a lot more questions that you have, and it's going to help you better navigate the healthcare system here on campus. The thing we don't want to happen, and the reason we are having these meetings, is that we don't want you to struggle. We don't want you to get caught off guard if and when something comes up during the semester and you don't even know where to go. You don't know where to get started. You didn't print your insurance card. You didn't go to a network provider, because these things can be costly. They can, affect your health. They can affect your pocketbook, but we want to get ahead of the curve and provide you a general overview of how these things work. We also, again, want you to check out your My ASU Health portal. Just get in there, check it out, flip through it so you can get familiar with it if you ever need to use it. You can go to the insurance company's website at UHCSR.com. That's the customer service number listed under United Student Resources. But also, if you have questions, there's an email. We have an advocate, Arizona Advocates at UHCSR.com. They work for the insurance company, and you can get a hold of them directly through that email if you ever need assistance with your insurance. We have a 24-hour crisis line that's dedicated to our ASU students that's available 24 hours a day. If the counseling center is not open, okay, and you need to talk to somebody, that's not a problem. You can call the 24-hour hotline. Also, we want you to go to the link that's on the screen. It's called Open Call, Open Chat. It's where you can download an app, and you'll be able to talk to a counselor 24 hours a day, 7 days a week, from anywhere in the world. Okay, and this is a free service that Counseling Services is providing you as a student. So again, I cannot stress enough, you might be healthy. Most students that are coming in are young. This is maybe not a priority or importance right now. And really, if you're going to be here for the next 3 to 4 years to complete your degree here, the question is not if, but when you will need these services. So again, if you know the basics, you're going to be a lot better off when that happens. Now, we are committed to our students, especially our international students. We are beginning to do more collaborations than ever with ISSC and other departments on campus. Okay, we're engaging international students to the best of our ability, and we look forward to continuing to expand. We do have insurance workshops that are coming up throughout the semester. Some of the workshops included Healthcare 101 to give you a better understanding, navigating the insurance portal and your My Health portal, okay, where we go into even more detail and more depth on what's going on there, understanding healthcare costs by using real world examples, okay? So that's going to be coming out very shortly, and we strongly encourage you and to let your friends know to please join us when these workshops are available. Will also be an opportunity to ask questions. We're going to be doing orientations. We're going to be doing panels and special events throughout the semester. We'll be doing tabling events. We'll be out and about more than ever. And one thing that I do want to point out is that even starting now, throughout the fall semester, we will have weekly virtual office hours via Zoom. Okay, this is going to be on Tuesdays and Thursdays. They start at 9 and go through 5 p.m. If you don't want to send us a portal message, you don't want to walk in, and it's just easy and it's convenient. We're trying to leverage technology to benefit our students and benefit our department. You can click on the link or on the Zoom office hours little logo there to access the virtual office hours on Tuesdays and Thursdays. So again, we're going to be not only here for you here now, but we're going to be with you throughout the semester and throughout your time here at ASU. So with that being said, I think I've come to the last slide, if I'm not mistaken. Now we can go ahead and open it up to questions that you may have or clarification that may be needed. Please do not hesitate, because that's how important this is. Okay.
Right. Thank you, Luis. The questions are coming, and we're going to get to them in a second here. Just want to talk about a couple more slides before we get to that. I just want to bring it to your attention that we do have a QR code here for International Student Digital Handbook. Please take note of this QR code, and it's a very detailed book, but something that you can read while you're traveling here to ASU in the plane, the long ride. Great resource. Definitely check it out. Also, I just want to let you know, next slide, please, that we have one more session left, a Q&A, which is going to be on August 4th. So please make sure that you register for that. That will be strictly question and answers that we have covered or not covered in our pre-arrival webinar so far. If you have any questions, bring those questions to us, but that will dedicate a whole hour here just to answer those questions. So having said that, Luis, a couple of things that we're seeing here, people talking about, so I'm going to bring it to your attention. Can you please tell our students about the 911 emergency system that we use, that people use here in US, so that they're not confused that if there's an emergency even on campus, they can go dial in 911 instead of going to the health services.
Yeah, again, I want to be clear, the health center on campus is not an emergency room for a life-threatening situation. And so here in the US, we have a system across the country and across all cities, and even here on campus, where the number to go to is 911. I don't know if they have something similar in other countries, but here in the United States, wherever you're at in a life-threatening emergency, it's 911. And again, it is no different if you're on campus. So if, say, you're walking down, Palm Walk, or you're in the, Memorial Union, or perhaps you're in your dorm, or perhaps you're on a field, or perhaps you're in a parking. If you have an emergency situation, you dial 911, or you get to the nearest hospital emergency room. Also, what's going to be really important to know is that on our ASU Health Services website, when you go to our website, there's different tabs that you can click through on the top. It lets you know our locations, but it also lets you know what hospitals and urgent cares are in the area for your campus. So again, I'm gonna strongly encourage you to go to the ASU Health Services website, go through all the different tabs, and one of the tabs has our locations, but it also has locations for urgent cares and hospitals in the area of that particular campus that you're in. Okay, so you know where to go.
Thank you, Luis. Another thing I wanted to kind of quickly cover is HIPAA and the privacy that's linked to it, especially in the US for our international students to understand that concept.
Yeah, thank you, KJ, for bringing that up. That's very important. So if you're 18 and over, you're considered an adult. There's certain laws, privacy laws here in the United States, and the health center has an additional layer of requirements. So what I mean by this is that if you, as a student who's 18 and over, would like anybody to assist you with your care on campus, and this goes for the health center and counseling center, okay, whether it be your parents or anybody else, you will need to fill out a consent form giving your parents or whoever you want to have permission to assist you on record. If we do not have that on record, if your parents call or a friend is coming to assist you, we cannot give them any information by law. It's just something we cannot do. And unfortunately, it may be inconvenient. People might get upset. But if you do not fill out that document and put it on file here at the health center or the counseling center, we will not be able to divulge information. And to get that consent form, you can go to your My ASU Health Patient Portal. And once you're in your My ASU Health Patient Portal, there's a tab there that says, I believe Forms. Okay, Forms. And you can click on there and it will be there. You can fill it out and send it back through your portal as a message to the records department. Now, if you're under, this is so important, if you're under the age of 18, you're not 18 yet, you need to get into your portal and there's a consent form for your parent or your guardian to complete. Okay, you would be able to print it out. You would have your parent complete it and fill it out, and you would submit it to the medical records department through your portal, or when you arrive, you could come in and hand it in. Because if you're under the age of 18, we need permission from your parent or your legal guardian. And this is something you should do, as soon as possible. If you haven't left already, then try to get this filled out and completed and turned in when you arrive.
Thank you, Luis. Another question kind of on the dates of coverage. So let's say they start this semester and continue to the next year. What are the dates of coverage that they have for which they have already paid for or they will pay for students insurance?
Yeah, so this is how it works. You're billed by semester. So if you're a new incoming international student, for the first time, you do have an early arrival coverage. Again, this cannot be changed or modified. It's just the way the university is set up. Your coverage will go from July 19th through December 31st. Okay. Once that date ends, your new coverage for the spring semester, once you register for spring classes, your spring coverage for the insurance policy will go from January 1st through August 15th. So the spring semester will cost more, but you're covered all the way through the end of summer. So it costs more because you have 3 extra months of coverage. Now, regardless of whether you're enrolled in summer classes or not, then you will be covered and it's included in your spring coverage fee. Okay, and then back in August 16th of next year, fall 26, the new year starts for the insurance policy. I don't know if that made sense. That makes sense?
Okay. Absolutely, that's exactly what we're looking for. Thank you. And then just to clarify, when they have coverage, they can go out of state and still have this coverage out of state or international or international?
Yeah, so the great thing about this insurance policy is that you have coverage not only on campus, not only in the Phoenix area, but throughout the entire state of Arizona and throughout the United States of America. There's also a travel insurance component built into it. So if you were to travel outside of the US, you can call the insurance company before you travel to get more details and information on how that would work outside of the US. Now, in the US, once you leave the Phoenix area and you're beyond 50 miles of ASU, if you're traveling and you're beyond 50 miles of ASU, you do not at that point need a referral from ASU Health Services or ASU Counseling. Okay, say you're traveling to Los Angeles, say you're traveling to New York, say you're traveling to Chicago, Miami, Houston, wherever. If it's more than 50 miles away, you no longer need a referral from us, but you do need to make sure wherever you're going is in network with your insurance company. And we already talked about 2 ways on how to find that out. It would be to get into your insurance company's account and use that tool, and or call your insurance company's customer service on your insurance card. Let them know, I'm in Los Angeles. I need to find an in-network provider. Can you please help me? I'm in New York. I need to find an in-network provider. Can you please assist me?
Thank you for that. And another question that came up was that this insurance is mandatory, so they don't need insurance coverage from back home because this will supersede that insurance in the US, right?
Yeah, this is a pretty comprehensive health insurance policy. You do not need to purchase any health insurance outside of this policy. Again, the way this insurance policy is built, it's built around students, and especially students that are traveling, which includes international students. Okay, so you do not have to purchase any insurance policy separately and independently of this, unless you're over the age of 19 and you want to purchase a discount for dental and vision. But besides that, and if you have done so already, I would call that insurance company and cancel that other insurance.
Thank you, Luis. And our senior coordinator, Yaya, had brought a very good question to my attention. F2 coverage for dependents for F1, how does that work here?
So we do not have dependent coverage under this insurance policy, but you can reach out to us through your patient portal. You can send a message to the Student Health Insurance Office requesting information for dependent coverage. Okay, requesting information for dependent coverage. It will have to be outside of ASU, and we will go ahead and give you that information on how and what to look for, what questions to ask, and how it would work. But unfortunately, there is no dependent coverage under this US policy.
Okay. And I've seen a bunch of questions here, so I'm just going to summarize it and tell me if that is correct. So apart from what the students have paid for their insurance coverage, the maximum out of the pocket they will have to pay for one whole year is $1,500, which includes medicines, going to the doctors, going to emergency rooms, all of it put together. Maximum will be $1,500.
That is correct, KJ. And again, I'm glad you're stressing that point, and we want to stress that point because, again, healthcare in the United States is extremely, extremely expensive. It's probably one of the most expensive things people have to be aware of when they're in the United States. Okay, and that is true. 1,500 US dollars is the maximum you as a student would pay for all your healthcare needs, as long as you follow the insurance company's guidelines. And again, you get referrals, you stay in network, and follow any other policy details that they require. That's why it's going to be so important to become familiar with your policy. Call the insurance company directly. If you have any questions, don't assume things. And if need to, you can reach out to us and we could assist you to the best of our abilities as well.
Perfect. A good question popped up. Actually going to ask that if they are taking regular medications back home, is there a process where they can get it transferred here so they don't have to keep getting those medicine sent from home?
You know what? I'm going to suggest, again, the prescriptions from outside of the country are not going to be valid here. So I'm going to suggest if you do have a pre-existing condition or are taking medication, that you try to set up an appointment as soon as possible here at the health center, because when you come to the health center, the first time you visit, one of the things you're going to do is you're going to fill out a medical history form. They're going to want to know your background. They're going to want to know any medical conditions. They're going to want to know what medications you're taking, so that that way they can go ahead and assist you and help you get set up here in the United States. So again, do not let that go. If you have a pre-existing condition or taking medications, please make an appointment as soon as possible so you can touch base with one of our medical providers that will assist you on getting set up.
Perfect. Thank you. All right. We are.
Hey, did you just a
go ahead.
couple
Sorry.
minutes?
I'm sure. Absolutely.
Hey, thank you. It's Jessica. Hey, so I just wanted to kind of address some of the most common questions that I was getting in the chat. If you are trying to register your My Account and you guys are having issues, it sounded like some people were having issues with the phone number, getting the text for the password or pressing the pound. It may be due to your VPN. The same thing if you're trying to download the app. I do know that you have to have your app store set to the US, and that may be an issue if you're also trying to just register your My Account. So if it's possible and you can register that before you guys arrive, that's great. If not, no worries. Just make sure that's one of your top priorities when you do get into the US and you have access to like our VPN, just getting that My Account registered, because it seems like quite a people were having some issues with that. Another thing is make sure that your name is matching what is in your My ASU, especially sometimes if you have multiple names, sometimes the naming convention may be incorrect if you're trying to register your My Account. So for example, like my name is Jessica Lynn. If I'm trying to put that in my first name, but I'm registered in my ASU as only Jessica, it's not going to match. So your My United Health or your My Account with United Healthcare is going to match the exact same naming convention in your My ASU. So again, if you have multiple names, just make sure that those are matching, and also make sure that you are matching the convention for your date of birth. Here in the US, we go month then date. So sometimes students are putting the date first and then the month. So just make sure again that the name and the date of birth convention are as what United is requesting. If you are having issues getting those My Accounts registered, you would have to connect with the customer service team over at United Healthcare. Unfortunately, we're unable to, if you like lock yourself out, if you're having issues registering, you would have to connect with their customer service team. You could do that via phone or via email. And then if it's again something just due to the VPN or your international number where you're not able to do that in your home country, just again, as once as you arrive into the US and you kind of get your first couple days here, just put that as one of your priorities to get that My Account registered.
Jess, also sometimes the first and middle name are on the first name, right?
Correct. Yeah. So sometimes again, if you have 2 or 3 first names, it may only, because there is a certain character limit as well. So if you do have like 3 or 4 names, again, if it's something that's not matching, it's not going to take it. You can always message us in your health portal and we can verify what your naming convention looks like and provide that to you. That way you can try, like I said, if it's Jessica Lynn and you're just putting, Jessica or Jessica Lynn, but there's too many characters, we can provide you that, because I have seen where students may have too many characters and they've cut it off like mid, third name or something like that. So if you are having any issues with that, we can always verify what United has your naming convention as in the system as well. The other thing too is if you have just registered for class yesterday, that student health insurance has not been activated. So if you registered Monday or Tuesday, that won't be available until the end of this week. But if you have registered since as of last Wednesday, your enrollment should already have been processed and it's available for you. So if you are doing any last minute registration, or if any of your friends are doing last minute registrations and they're trying to get into that student health insurance account like the same day or next day, it does take about 72 hours for that to process. So just kind of keep that in mind if you are doing any late registration, or if your friends are doing any late registrations. It's not an instant thing where that student health insurance is available. I think that was kind of all I had was for the most common questions was just trying to get in the naming conventions and then also the VPN for the App Store. Again, like I said, just make sure once you arrive to the US and you switch your App Store to the US, then you should be able to see the Student Health UHCSR app.
Perfect. Thank you.
Great, thanks, KJ.
No problem. I have a student raise your hand. Please put in your question in the Q&A and we're going to go through it. We still have a little bit time left here. So let's see here. I'm going to read a couple of questions here. I downloaded the app, but it says that I don't have access to that portal. Is that because they are not in the US? Could it be?
Yeah, it could be for, maybe they're not in the US, and also it could be perhaps the system's updated once a week on Wednesdays. So if they just registered last Thursday, it won't be uploaded or activated until probably this Thursday, Friday. So if you try a couple more times in a couple days and it's still not working, you can portal message us and just send your message through the portal to the Student Health Insurance Office. Because what's happening is we're having different international students registering at different times, and there's cutoff periods and there's processing times. So like Jessica mentioned, it's not instantaneously. It might take a couple days for it to upload on all systems.
Perfect. And there's a question here. If I have medical prescription for medicines from my home country, can I use them in the US? I'm assuming they're talking about the medicines because you already answered about the prescription, but maybe you want to.
Yeah. So again, if you're taking medicine or prescriptions, I'm not a medical doctor, but we do encourage you to make an appointment through your My ASU account as soon as possible so you can talk to a medical provider about your medical conditions, your medical history, and any medication or medicines you're taking, and let our professionals assist you and help you navigate through that.
Thank you. A question here. If I set up the account with my home country's phone number right now, will I have the option to change it later to a US number once I arrive?
Yeah, that's going to be really, really important to update your US address and your US phone number. Because again, sometimes it may cause an issue with the insurance company because they might have to get you some important information. And if they don't have the right address and right phone numbers, it could cause some problems with your enrollment. So as soon as you can, please put a US address and a US phone number.
Another question, KJ, I was kind of getting was cost for the MMR vaccines. Your MMR vaccines are covered at 100% at the health center. You can make an appointment with our nurse clinic at any campus health center. As Luis mentioned, we have a health center at all 4 of our locations. So you can schedule an appointment with our nurse clinic. Those vaccines are covered 100%, so you won't have that $15 copay that we talked about. It is a little bit tricky. So let's just say if you have an appointment with a medical provider and you get that vaccine at that time you would have a $15 copay because you're having a medical appointment. So let's just say you're like, hey, I'm meeting with the doctor regarding my anxiety, and then I also want to get my MMR at that time, then at that time you would have that $15 copay. But if you just strictly schedule an MMR vaccine with any of our campus nurse clinics, you don't pay anything. You don't have a cost for that. You don't pay for the vaccine, and that applies to both the first vaccine and the second one. If you need to get an MMR titer, that would result in the $10 lab copay, because I know some students have asked about the titer test as well, proving that you have immunity to the measles. That would have the $15 copay, but if you are getting either the first dose or second dose of that MMR vaccine, it is covered 100%.
Thank you. A question here, is psychiatric care included in the plan?
Yeah, psychiatric care is included. We don't have a psychiatric provider on campus. So you would have to come to the health center or counseling center on campus first, as mentioned in the presentation, but they would go ahead and provide you a referral to go to a psychiatrist off campus. And again, with that referral and with staying in the network, that visit would be $25.
Thank you. All right, keep the questions coming. The quick answer here, quick question is $1,500 max out of pocket is for the entire year and not just per visit, right?
That's correct. It's for the entire policy year, which includes the fall, the spring, and the summer. Again, don't forget and make a note, it's not the calendar year. It's not from January 1st to December 31st. It's from August 16th to August 15th of the next year. That's the year for this policy.
Perfect. And something that Jessica said earlier about no copay, since I'm a big fan of preventive medicine, I know I've talked to students about how they should get a routine exam done once a year, which should be free of cost, which means that they don't have to pay any copay. Is that correct?
Yeah, so there's one routine visit, one routine full checkup per policy year at no cost. But when you make the appointment and when you're seen, you got to be very clear with that provider. This is a routine yearly checkup. Okay. Once you start talking about anything else in that appointment, your knee, stomach issues, anything else, then the provider will code it differently because it becomes a specific appointment, and then you'll be charged those $15.
And in regards to preventative vaccines, the MMR is not the only one that's covered at 100%. You can get your flu vaccine, your HPV vaccine, your Tdap. If you are doing any travel or study abroad, be very careful with those vaccines because they are covered at the health center, but you will want to make an appointment with the nurse clinic just to make sure that we're able to provide you those required vaccines, that we carry them. Because if you go off campus to a local CVS, Walgreens, a Walmart, those vaccines might not be covered by your insurance. So if that is something that you will be studying abroad or need any travel vaccines, always start with the health center first. That way we can direct you to where the appropriate place would be to get those vaccines. But again, in regards to preventative health, the MMR, your HPV, your flu, those will be around, I believe, in October. Those vaccines are all covered at 100%.
And there's a follow-up on that, Jessica. Question is, I have taken my first vaccine in my home country. Can I take the second one at ASU?
Yeah, absolutely. If you have not already, I would upload your vaccination card or proof of your first MMR to the through your health portal. That way our immunizations department, what they do is they'll put like a temporary waiver on your account in order for you to register, for you to make that appointment here at the health center to get that second MMR.
Perfect. A great question here. Is there also a gynecologist routine checkup included in the insurance policy?
There is, we do have a women's health team on each of our campuses, so that way you can do a well women's exam. That would be included, it's covered at 100%. Some women choose to do that, as Luis kind of mentioned, with their routine annual exam. Some women choose to keep those separate, but there would be no copay for either a wellness exam or a well women's exam. And that would also include any of the labs. When you do your well women's or your routine wellness exam, all your labs are covered. So, they'll check your thyroid, your CBC, your CMP, your lipids. At that time, those lab fees are also waived.
Okay, a quick question here. Oh, you're asking to answer anything. Yeah, going back to that routine checkup, it's very common in the US for everybody to get checked at least once a year. Is that a correct statement, Luis?
Yeah, yearly checkup. That's why the insurance company offers it. Again, we know a lot of our students coming in, especially our international students, haven't maybe been to a provider in a while. So again, if it's something that's free, you're paying for it already, it's covered, it's a good place to start getting on track with your health and wellness. Again, we encourage you to take advantage of it. But again, when you make that appointment, when you see the provider, you just let them know it's a yearly routine checkup or yearly routine women's health checkup. It has to be clear.
Yeah, and kind of piggybacking off what Luis just said and one of the questions in the chat right now. So again, if you come for an appointment regarding your stomach, regarding your heart, regarding your skin, and you're like, hey, I want to get my vaccination at that time, you still have that $15 copay, but you don't pay for that immunization or that vaccination. But if you're just going to the nurse clinic and you just get that vaccination, you don't pay that $15 copay. So again, how Louise kind of mentioned, it's really important of, hey, I just want to do my routine wellness exam, nothing else. But as soon as you start talking about some other medical concern, it will trigger that $15 copay. So you might have the copay $15 bill, but again, you don't pay for that vaccination or immunization.
Also, I do, before I forget, I do want to point out that the insurance usually, okay, not, I would say operates under the assumption that something, you're receiving a visit or a service is medically necessary. It's not under the assumption I'm just going to the doctor or trying to get services for no reason at all, unless it's a preventative service, of course. But, again, there's sometimes students want to come and get all kinds of lab work done, but there's not a medical reason to get all kinds of special lab work, written up. And the insurance company will be like, well, what is the reason for these 20 different labs? Why are we going to pay for them if there's nothing medically attached to those labs? So just be aware of that. Usually it's associated and under the assumption that something is medically necessary to look into.
Okay, we have, do the panelists have anything they want to add right now while we're waiting for more questions?
Well, again, I just want to encourage everyone, again, to take a few minutes to look at the ASU Health Services website, the ASU Counseling website. Take a few minutes to go through your My Health patient portal on your My ASU so you can get familiar with it. And also, if you're able to, create your insurance account with United Healthcare Student Resources now or in the next couple days. This is just kind of something that really is a checklist that we would want you to do, and which is going to be very important, so you don't have to worry about it later. Again, you're off to a great start. We do want you to get into that mindset that you will be responsible for your health and wellness. Okay, your parents and guardians are going to be able to assist you, but if it's a long distance kind of thing, it's going to be difficult. Although we're also going to be here to assist you. The insurance company can assist you. Ultimately, it's going to be up to you to be proactive and take ownership of your health and wellness. Because again, if you're not healthy and you're not well, it's going to be very, very hard to be successful academically and successful in any area of your life, with relationships, with work, with extracurricular activities, and all these things are connected to health and wellness. And again, this is kind of one of the first big steps of walking into the adult world, is being responsible for your well-being. And again, I cannot stress it enough. Please get that mindset. Please, embrace it, and don't avoid it, because we want you to be healthy. We don't want you to get sick. We don't want you not to be healthy during your time here. That's why you have insurance. That's why there's providers. That's why the ISSC is here. That's why the health center's here. That's why all these departments are here, to make sure that you are successful.
Great point. Quick question here. Is the vision discount plan an additional plan separate from the standard coverage? Yeah,
so our discount plan is through Carrington. I don't know if we're able to put it on the chat, but if not, it's on the United Healthcare Student Resources website. If you scroll towards the bottom, it's on their website. It's actually through their website, and it's $25 for the year, school year. And it's not an dental or vision insurance. It's a discount program. But for $25, I would go ahead and enroll in it. And what it does is that they give you certain locations you can go to that are in that plan's network. and you get like a 20 to 30% discount, up to 50%, depending on where you go and what you need. So it's kind of like a no-brainer, because dental and vision insurance is also very expensive in the US. And for the most part, our student population doesn't have too many dental issues. So that's why dental insurance is not offered, but this discount through Carrington is offered.
But just to clarify, if there is an issue that's linked to dental work or something with vision, that would be covered to the insurance. So, for example, if somebody falls down and breaks their jaw and you know, something
Yeah,
happens.
so the exceptions for 19 and over, for students that are 19 over, exceptions are if you have an injury to your teeth, okay, or you need your wisdom teeth removed. Those are the only two exceptions when it comes to anything having to do with your teeth. If you have an injury, an accident to your teeth, and or you need your wisdom teeth removed, you can contact the insurance company directly. They'll send you to their dentist and they'll pay 80% of the cost. Okay. Now for vision, okay, for vision, if you're 19 and over, you have one routine vision exam, just a routine exam. Anything extra is not covered, but just a basic routine exam. One a year is available for $25, and you can call the insurance company directly for that, and they'll set you up with providers that work with them.
Thank you. All right, keep those questions coming. We have a few more minutes left here. If anybody wants to, any of the panelists want to add anything here, please go for it. Thank you.
Hello everyone, it's Yaya again. If you have submitted any questions, health insurance, health services related questions via our Google form earlier, we will make sure to have that passed on to Lewis and team and have the answers emailed to you as soon as we can. But please keep your questions coming.
Again, we just want to remind you, again, again, no, this is a lot of information. Okay, this is a lot of details, a lot going on, understandable, where it's hard to kind of get everything. But again, we're not going to just be here today. We're going to be here throughout the semester. Okay, we're going to be doing workshops. We're going to do outreach events. We're going to be doing orientations. We're going to have Zoom hours on Tuesdays and Thursdays throughout the entire semester and throughout the entire year, I believe. Okay, if and when needed, we're available in person if you want to walk into the health center. Okay, so we're going to be available, and we don't want you to feel like you have to absorb everything here today. Okay, because again, we're going to be here, we're going to help you, and in no time you'll be able to navigate and know what questions to ask, where to go for the right treatment, for the right services. But again, we want you to reach out to anybody, whether it's at the ISSC department, reach out to us here at the health center, at the counseling center, to your professor. And we're all pretty good at helping students connect and get to that resource they need. Because a lot of times I'll talk to students and it'll end up in our conversation where they need other support, and I'll help them get connected to those additional supports. Same thing with ISSC. You guys might be talking about a particular issue or matter with your ISSC advisor, but then they couldn't help you connect or you get to the health center or the counseling center. So again, ASU Health Services, when you get here, it's a big place, but also it's a personal place, because that's why we work here and that's what we're here for.
And also, remember, if you utilize counseling services, they are free of charge. They do not have that $15 copay as the health center does. So if you're like, hey, I just need to do like a quick check-in, I just want to talk to somebody, or if you need to have a full appointment with them, they're available at no cost. They also have on their website information of their app which you can talk to. It's called Open Call, Open Chat. So you can talk to anybody anywhere in the world, 365 days a year, 24 hours a day. We do also have our impact crisis line, as that information's on the website. So if it is something outside of regular office hours for ASU Counseling Services, you still have some resources to use. But again, just remember counseling services is available at no cost. It's a little bit different than the health center. They do have that free service for you.
I do want to ask and see if this works, KJ, if any of our students can indicate by raising their hand if you've already had the opportunity to check out our website. Have you checked out the insurance company's website? Have you gone to your My ASU Health portal? If any of you have done that, can you indicate by raising your hand?
I have
And that
4, 5, 6, 7 hands raised.
okay, we have about
8.
we've had about 100 people in here, so we're gonna need more hands to go up.
They
Okay,
are
we're
going
gonna
up
need more
slowly.
Yeah, we're gonna
10.
need more hands to go up. And we're really confident. We're really confident that you're gonna be an ambassador for health and wellness, that you're gonna be an ambassador for the student health insurance plan, and that you're gonna share this information with 2 or 3 of your friends, okay? Because again, they might not have picked it up, they might not have attended, they might be confused, they might not be aware, they might have slipped through the cracks somewhere. So you're gonna have to be an advocate and an ambassador to your friends and let them know about health and wellness. Let them know about the websites. Let them know that they have to register with the insurance company and that they should check out their My ASU patient portal. So again, the ask that I have is that if you've got a grasp of this, at least the basics, please, please, please share this with 2 or 3 other of your colleagues and your friends that are coming in.
I think we had 15 raised hands, so that's good. If you have any more questions, please have them coming. We have a few more minutes left. At this point, I want to say something that happened to me as when I came as an international student here. I think that it's important for international students to know that their medical information is private, that they don't have to share it with anybody unless they want to. And that's important because I didn't know that when I came to this country, and I would go around and sharing my information with my professors because I was feeling sick and I wanted to tell them how sick I was, and I would go into details. And I want everybody to know that this is not necessary here. And Luis, if you can please elaborate on that, or at least confirm that that is true.
Yeah, so your medical information and details is at your discretion, okay? That's one of the reasons why there's an additional laws and layers of privacy protection for students and patients in a health center environment, medical environment. And again, in order for us to share any information with anyone, you have to fill out a consent form and put it on file at the health center. Okay, that's going to be at your discretion. Of course, outside of the health center, who you share your information with is at your discretion. You don't need to. And as a matter of fact, your information is protected under the law. So that's going to be at your discretion. But a good point, KJ.
And that will also include your professors. You know, they can't ask you why you're out, what medical conditions you have. If you do miss class and you have an appointment at the health center due to your illness, you can always ask your medical provider for an excuse note to provide to your professors. But without that information coming directly from you, your professors are not allowed to reach out to us regarding, you know, hey, did my student have a visit? Hey, what's going on with my student? Are they sick? What's their illness? So again, if you do need an excuse note, if you do miss class, that is available to get through a medical provider, but the health center will not just release that information to your professors as well, or anybody in your dorm, your RAs, anybody like that.
I do want to be clear. Again, your conversation with your professor is your conversation. Of course, if you know you want to give general information, you know that is a conversation for you to have with your professor, but specific details of your medical condition or history is not required. And that's where you can touch base with the health center or the counseling center to get notes. That would be helpful at times.
Yeah, and just to piggyback on that, even if you end up getting work as a student worker here, your employer should not be asking you about your personal medical information.
I do want to, again, encourage you to be checking your My ASU Health Patient Portal. You will be notified through your ASU email that you have a portal message. We send 2 or 3, 4 messages every semester regarding details regarding your student insurance and how to access medical care on campus. So again, please check your portal because you might get important messages from your doctor that you're seeing here. Okay, from a referral department, we might follow up with you. So don't ignore those messages that are coming in through your portal. Same thing with your United account, your student insurance plan account. They sometimes send you messages and alerts that you have to respond to. The insurance company sends you messages through their account, and if you're not responding, they might not pay your medical bills. Okay, so healthcare, health insurance, visits, it's very serious here in the United States. So please do not avoid any messages that are coming through your United Healthcare account and your My ASU Health portal. Okay, I'm hoping that this introduction was helpful. I'm hoping this introduction gave you a general overview on how and where to get started. This is just the beginning. Again, there's going to be plenty more opportunities for us to engage with you and for you to engage with us. But at the very least, you kind of got a quick introduction to U.S. healthcare, also your insurance company, and also healthcare here on campus through the health center and through the counseling center.
So I'd like to thank everyone for joining today's webinar. I would like a repeat of the information shared today. We'll be sharing the slides via email to you sometime soon. The full recording will be available on YouTube, ISSC YouTube as soon as possible. A big thank you to our health insurance team, Louis and Jessica. You've been great. Thank you again for your support in making this possible. Stay tuned and feel free to reach out to ISSC or our health insurance team if you have any further questions.
Thank you, everybody. Welcome to ASU.